you are joining on the live stream, welcome. Just so you know, if something happens with the live stream or you have to hop on somewhere else, we will be recording both of the talks being given tonight. And you can access that on our website, which is www.marionuniversityalliance.com. Those will be posted shortly, probably tomorrow. So you will have a chance to get all the information that you want. So I'm going to wait like a couple more seconds in case people are joining on. All right. So if you don't know who I am, my name is Julian Santos. I am the current Vice President of the Marion Queer Alliance on campus, and soon be President for the next year, 2021 to 2022. I'm really excited to be sharing this event. This is something that we've been kind of working on for quite some time. We've been in communication with several off-campus partners who have been very gracious to give us their time this evening to share some important information and resources. This event is obviously called LGBTQ plus Health Fair. We wanted to do this event for a couple of reasons. One being that so often queer people do not have access to the resources that are there for them. There's so many resources, opportunities, and information, and a wide span of topics that queer people just sometimes don't know about. And so part of the reason why we're having this event is to connect people with some of those resources. Another reason we're having this event is because as students, especially university students, health is a very important thing and also a very challenging thing when we talk about finances and time. But we want to put an emphasis with the Marion Alliance that we want to support you in every aspect, whether that be physical health, mental health, emotional health, and so on. So before we get started with our speakers, I wanted to plug some of the resources that we have on campus for students. Both resources, the Student Health Center as well as the Counseling Center, wanted to be here and present and speak with everybody, but unfortunately they could not make it. They have provided extensive resources that will be available in the Union Center for anyone who would like to pick that up. And they also wanted to express that they have the interest of the queer students in mind. For any of your needs, any questions, they are very accepting and supporting and want to help you to the best of their abilities. So yeah, if you ever need anything from either resource, you can go on to the Marion website and find it out that way, or you can email the MMU Alliance and we can get you connected. So with all of that said, that was a very long introduction, but I want to introduce you to our first speaker today. Robert is a part of the Damien Center, which is a health center located in Indy, doing really good work in regards to HIV/AIDS prevention and testing, and just getting information out to the community. So I'm very happy to introduce him, and yeah, thank you.
Thank you, Julian. I appreciate the introduction. Like Julian said, I am Robert Kelman, the Outreach Team Lead at the Damien Center. And I'm going to do a little presentation about the history of the Damien Center, the basics of HIV 101, and a little bit about, I'll touch on prevention a little bit, but I know Jay is going to cover that more in depth. But I really just want to share the information, the resources that we have in order to really dispel stigma surrounding HIV, so we can feel comfortable having the conversation about it. And I feel like the more that we discuss it, the more we'll be comfortable about it. So I'm going to try to share my screen here. Hold on one moment. There we go. All right, Julian, can you see what I see?
Yes.
Yes, okay, that's good. All right, so the Damien Center, we are the largest AIDS service organization in the state of Indiana. And really what our goal is to empower our community to know about and get in touch with resources that could be beneficial to them. If that is someone that is living with HIV, or if that is someone that is at risk for acquiring HIV, we want to be there as holistically as possible to provide any guidance and to really give individuals the tools that they need to lead long, healthy lives. The history of the Damien Center, it might be surprising to many, it actually started within the Episcopal Church. So in the mid to late 80s, truly at the height of the AIDS crisis, there were a group of people in Indianapolis that were seeing their friends and family members displaced. People were kicked out of their homes. Individuals weren't accepted into hospitals for care with an AIDS diagnosis. So these individuals, volunteers, came together, approached Reverend Earl Connor and asked if he would open the doors to his abandoned church in downtown Indianapolis, and he did. And that is how the Damien Center got started, entirely staffed by volunteers at first, with support from the Episcopal Church, and they really created a space for individuals that had AIDS they created a space for them to die with dignity, because unfortunately there wasn't truly effective treatment in the 80s, early 90s to sustain a long, healthy life with HIV/AIDS. So now we want to give our clients the dignity they need and deserve in order to live long, healthy lives with HIV. So the Damien Center is a one-stop shop for HIV care. We want our clients to come in for one appointment and hit all of these different departments that we have within one building. We have a medical center called Damien Cares where clients can get primary health care and get lab work done. We have a on-site pharmacy, so when our clients get a prescription written by the provider, they just go right to our pharmacy and get their prescription filled. We have case management, which means basically a caseworker to help clients navigate any difficulties or challenges they're facing in their life. We also have a food pantry that clients can access bi-weekly. We have a mental health and addictions counseling wing that focuses on mental health. We have a linkage to care department that is integral to our work. The linkage to care department is super awesome because they're not only there to counsel individuals if they receive a reactive or positive HIV test result, which is super important. We don't want to just give someone a test result and send them on their way. We have individuals there that can sit and talk to them about next steps, but also they go out into the community and try to re-engage former clients into care. So if any client falls out of service, we don't just close their file. We want to find out why and how we can do better or help them in order to get re-engaged into care. We also have a youth services program that is fairly new and is not limited to individuals living with HIV. It services young adults ages 18 to 24 with housing. We also have our traditional housing department that helps our clients with emergency short-term and long-term housing needs. We also have a prep and prevention department, which I am a part of, and the HIV and STD testing department as well. So I went through that pretty quickly because I don't have a lot of time, but we have all of these services under one roof at the Damien Center. We have funds available to help people access these services. Many of these services are at no cost to the clients, and it's important to know that we're trying to expand most of these services to individuals that are accessing prevention services. So not everyone that can get these services, they don't all have to be living with HIV. So, like I said, it's important to remove the stigma surrounding HIV, and I really like to go bare bones at first just to explain what HIV is. So really I find that many people don't even know what HIV stands for, and it stands for Human Immunodeficiency Virus. It is a human-to-human virus. I will talk about how you can or cannot contract HIV and all of that, but it's important to know that it is passed on from human to human, not animal to human, vice versa. Making your immune system weak or deficient. So the virus comes in, attacks your white blood cells, attaches to them, and then reverse transcripts and creates billions and billions of them in your body, taking over your immune system. We need our immune systems to stay healthy and fight off infections and live healthy, functioning lives. Many people don't know that HIV has stages. I know that many of us think about stages of an illness and we think of cancer, right? So HIV has 3 different stages. The acute infection stage, the clinical latency stage or HIV inactivity stage or dormancy, and then the last stage, which is AIDS, which I'll get into as well. So, stage 1 of HIV. So I have this acute infection stage diagram up here, and it's really from the moment or a couple of days after possible exposure, or no, actual exposure to HIV. So the day of or a couple of days once you've been exposed to HIV. During that time, it's about 1 to 4 weeks. Some individuals might not have any symptoms at all when they've been exposed to HIV. Others might have flu-like symptoms like swollen lymph nodes, fever, chills, night sweats, and some might just say, oh, I might have the flu or I might have a cold, and they don't get tested or they don't want to get tested. Well, the tests, most of the rapid tests that are available right now, let's say if you went out a week after you've been exposed to HIV to get a rapid HIV test. So you see that in this diagram, infected with HIV, it has a lot of the virus replicating at high levels in your body right now. That's the virus that the test cannot test for. The test is looking for antibodies, which aren't going to be present until around the 4-week mark. So if you were to get an HIV test after a week of exposure, you would get a false negative possibly, because the tests that are available that are rapid, they're looking for antibodies which aren't going to be present until around the 4-week mark, if that makes sense. So, although it's, I understand I've been in a situation where I think I may have been exposed to HIV and I wanted to go out and get tested right away. I'm not telling individuals not to do that. I'm just saying that it's important to follow up within a month to get another test just to make sure and be sure, because those rapid tests that are available right now are looking for the antibodies which aren't going to be present until around the 4-week mark. I'm sure that Jay, who speaks after me, will talk about something else that is available for individuals who have been exposed to HIV. I'm not going to go into that, but don't want to step on any toes. So, stage 1, HIV. Acute infection stage, I say that can last for from the moment of exposure to several weeks after exposure. The clinical latency stage starts when the amount of virus stops replicating at really high levels, like on the screen here, and antibodies are going to be present. So the clinical latency stage is when you are going to get an accurate HIV test result, and if you get a reactive, also known as positive test result, that means you want to start your antiretroviral therapy right away. So the sooner you start it, the better to control the amount of virus that is living in your body. You really want to get on ART as soon as possible, because you want to make sure that you're not going to end up with really high viral load that will ultimately turn into stage 3, which is AIDS. We want individuals to stay in the clinical latency stage of HIV for an average lifespan. Like, that's the stage that we want individuals to stay in. We don't want you to have to progress to AIDS because you really don't have to if you find effective antiretroviral therapy. It affects everyone different, the virus does, and so does medicine, so it's also early to make sure that you see what medicine works for you, and then you can stay in the clinical latency stage for an average lifespan. HIV is not a death sentence anymore. It is considered a chronic condition, and we want to treat it as such. So when I say a chronic condition, think of high blood pressure or diabetes. It's something that you have to monitor and that you have to take medicine to control and treat. So with today's technology and knowing about how important it is to know your status, getting tested, and being on antiretroviral therapy, we hope that individuals don't go to this third stage of HIV, which is AIDS, which stands for Acquired Immune Deficiency Syndrome. So it is acquired. There is something that has to happen. There are actions involved to acquire this illness. It affects the immune system, just like it says immune deficiency in HIV. It affects the immune system, making it deficient and or weak, and it's a syndrome. It's a collection of symptoms and illnesses that result in AIDS. So really, we're at a point where there's so much amount of the virus in your body, and you can't fight off opportunistic illnesses, known as like certain types of cancers or pneumonia. The common cold can turn into something much worse. So it just really means that your body's immune system and defense mechanism is compromised, and it's susceptible to opportunistic illnesses. So I think it's important to know what transmission or what fluids transmit HIVs. A lot of people have confusion about these, but these are the fluids that transmit HIV. And what this means is that there is enough of the virus in this fluid for it to be transmitted. So blood, semen, preseminal fluid, also known as pre-cum. A lot of people don't think, oh, well, I don't have anything to worry about because I didn't actually ejaculate. Well, pre-cum is present. HIV lives in pre-cum. Vaginal and rectal fluids. Individuals want to know what those mean. It really is mucous membranes and the secretions that come from them when you're having sex. Those are vaginal and rectal fluids. Also with breast milk, which I will discuss in a moment because I want to discuss pregnant women living with HIV. And then finally, spinal fluid. This is the fluid that I have to put all of them up here because, like I said, that means that there's enough of the virus in this fluid for it to be transmitted, but most of us won't come into contact with spinal fluid unless we're working in an ER or doing brain surgery or something like that. So all of these transmit HIV, these fluids. The routes of transmission. So these are the ways that HIV can be transmitted. Unprotected anal, vaginal, and oral sex. Anal sex is the most risky of the penetrative sex acts to contract HIV. Unprotected. Generally, when someone is having anal sex, there is tearing involved. So that means that there is blood that is present. That means that there is an open wound. So that's introducing another fluid and an easier pathway for HIV to enter the body. Oral sex is the least risky of the penetrative sex acts to contract HIV. Very, very, very rare. Obviously, sharing needles. If you're sharing IV drug equipment, you're basically taking someone else's blood from the vein and injecting it into your own. That is a route of transmission. Mother to baby is a route of transmission. It is possible. However, I think it's very important for us to know that if a woman that is living with HIV becomes pregnant, if she is adherent to her antiretroviral therapy, there is less than a 1% chance that she will pass the virus on to her unborn child. So less than a 1% chance if she's adherent to her ART. So that's really important to know. I did mention breast milk earlier. That is every woman's decision if she chooses to breastfeed her child. I was just saying that there is enough of the virus, there is generally speaking enough of the virus in that fluid to transmit it. However, that risk goes down obviously if a mother is adherent to her medication. Blood to blood. So a lot of people wonder what I mean by blood to blood. I'll start with this. So I've talked to many people when I've done outreach, and I learned about lots of different things that individuals do, sexual or otherwise, and I was having a discussion with someone, and he mentioned that he and his friends often cut one another and let each other bleed together, like they're blood sharing or blood letting. And it kind of dawned on him because he only thought of contracting HIV through sex. He didn't realize that there was a risk in having an open wound and sharing it with someone else and the blood being present and transferring into each other. Also, there are so many best practices for what I'm about to say, but getting blood transfusions. There are screenings and best practices in place where this doesn't happen anymore, that you can get HIV that way. But I bring that up because of a young man by the name of Ryan White, who put a different face to HIV in the late 80s and early 90s. He was from Indiana, and he was a kid, he was a teenager that was a hemophiliac, and he had to get blood transfusions often, and that's how he contracted HIV over 30 years ago. So he really put a different face to HIV because back then everyone really thought it was a gay man's disease, and they realized that it can affect anyone. And now a lot of the funding that individuals living with HIV receive is under the Ryan White CARES Act, which is a federal act that funds a lot of insurances and housing and medical needs for individuals living with HIV. So, how HIV is not transmitted. I think this is so important too, to relieve the stigma for people when you are meeting people that are living with HIV, so you're not afraid of them, or you're not afraid to be in their presence, or to touch them, or to do anything else. Saliva, sweat, or tears, none of those transmit HIV. So you're not going to get HIV from someone giving you a high five at the gym and you both have sweat on your hands. Or if you have a friend that's crying on you, you're not going to get HIV that way. Skin-to-skin contact, not getting HIV that way either. There are other STIs that you can get from skin-to-skin contact, but not HIV. Sharing utensils. Eating after someone, if someone's saying, oh, taste this soup, and they have HIV, you're not going to get it from that. Not possible. Sharing food or drinks. If someone wants you to taste a drink of theirs, or take a piece of cake that they were eating from, not going to get HIV from sharing food or drinks either. And you're not going to get HIV from insects or animals because, as I said before, it is a human-to-human virus. So those are the ways that HIV is definitely not transmitted. So I have a few slides about statistics. I'm not a huge numbers person because they confuse me, but statistics are pretty clear. Just to focus it on age, so this is from the CDC in 2018. It's the most recent chart that they have right now. I think they've been busy with something else called COVID. Maybe that's why they haven't updated it yet, but they're usually around 2 years behind. But the CDC 2018, you can see the number of diagnoses. So Center for Disease Control for individuals that possibly don't know what the CDC is, and this is just for the United States. This isn't worldwide or anything. So these are new number of HIV diagnoses in 2018 broken down by age. You can see the largest age group were for individuals 25 to 29 with over 7,700 cases, and then 20 to 24. But then you have the 13 to 14 age group, 19 diagnoses. You think, oh, we're such a large country, that doesn't seem like a lot. Well, these aren't people that actually don't even know their status, but 19 cases for children, essentially, 13 to 14 years old. I feel like the ball is being dropped and communication isn't happening, and it's just really important that we keep having the conversation because 13 to 14 years old in 2018, as far as we've come with prevention regarding HIV, I feel like we would love to see every number be 0, but it was kind of shocking to me. You can see 65 and older as well. It affects everyone. When you break those numbers down by age, Black and Latinx individuals are disproportionately affected by HIV, specifically Black and Latinx MSM. Men who sleep with men are way disproportionately affected by HIV. There are many discussions that happen and different reasonings that people come up with as to why. I could get into that, but that's probably best for another day. But it just shows you that the numbers affect different communities differently. By state, I didn't break it down by race, but people are usually interested in what HIV looks like in Indiana, and this is from the Indiana Department of Health, as it's known now, from 2018, and the numbers kind of match up really with the national numbers. So the largest age group that were diagnosed were ages 20 to 29, and then 30 to 39 were second, and with a total of 418 individuals. So that is what I have to share about the basics of HIV, and just to give you a little bit more understanding to relieve some of the stigma. You have my contact information up here. If anyone has questions that they want addressed or anything, I am available there. Thank you.
Thank you so much, Robert. Wonderful presentation. Thank you.
Thanks.
All right. So, I'm going to minimize this. You're not on display for the rest of the time. If you would like.
Oh, okay, gotcha.
So,
Never mind. I was gonna tell him he should mute himself, but never mind.
oh, yeah. Like I said earlier, that was Robert, who is from the Damien Center. Very, very, very important and wonderful information that was shared. It just reminds me how much I still don't know about HIV and AIDS. And that is something that, for me at least, is very important for me to know and to talk about and to be aware of resources and stuff. Another thing that I just wanted to highlight was stigma is so embedded in our culture. I actually gave a speech about AIDS stigma last year for the speech and debate team. It is something that we really need to talk about more, and that is another reason why we're having this event, to open that conversation and to get that information and resources out to people, because it's something that we all need to know about. So with that being said, I would like to introduce our second speaker for this event. Jay is a representative from Shalom Healthcare Center, and he is going to give us some more information about this topic, and we are very grateful to have him here.
All right. Well, hello everybody. Thank you, Julie, for the introduction. Thank you for inviting me. My name is Jay Castillo. I work for Shalom Healthcare Center, and I'm an HIV educator there and outreach specialist. So I'm going to be talking to you guys a little bit about HIV prevention and some resources around the state. There we go. My beautiful assistant. All right, so today we're going to talk about so we're going to talk about who we are at Shalom and what we offer. We're going to talk about a little bit about transmission. So I know Robert just spoke a little bit about that. And then the risk of unprotected sex. We're going to talk about some risk indicators, and as well as minorities and HIV. Why the stats are so high in these populations. We're going to talk about a few campaigns that Shalom has, and we're going to talk about PrEP and PEP, and then we're going to talk about the relationship with Shalom and Marian University, and then we'll have some time for some questions if you guys have any. So, who is Shalom? So, at Shalom, our mission is to provide affordable and accessible healthcare for all. We try to achieve that with our mission of introducing our patients to convenient ways to access healthcare at any time, any place. So you can do that either by going to our clinic, or we now have telemedicine available, and we also have our mobile clinic that we take into the community, and we actually take providers to provide healthcare to individuals out in need. So Shalom has been around now for about 25 years. It was started with 2 Jewish nurses, and they wanted to just bring those resources to the community. And now, fast forwarding to who we are today, our current CEO, Dr. Bernardo Ortega, he is extremely passionate about HIV. So he wanted to start a team. So in June, our team came on board. My assistant here is actually our PrEP navigator. So if you guys have any questions about PrEP, he will be the one to answer that. So what do we offer at Shalom? We offer primary care. So that's anything with kids, adults, anything from your stomach hurting to a headache. We can probably see you for any of that. We have behavioral therapy. We have outpatient substance use support. And we'll see how that ties in with HIV. We do free HIV testing. We have translation services. We also have social workers at our clinic. We do COVID-19 testing as well as COVID-19 vaccines currently. We also have financial assistance for everybody. Does not matter if you're a student, if you have a job, if you don't have insurance, if you do have insurance. Legal status does not matter. And then we also have transportation services, and we also do free PrEP consultations. Cool. So as Robert mentioned, just wanted to go on to emphasize that HIV is a virus and AIDS is the condition that is caused from that virus. Transmission, Robert covered that, so I kind of just work past it. So yeah, unprotected sex, injection drug use, pregnancy could happen. Ways that it's not transmitted: air, water, saliva, sweat, animals, or sharing toilet. So risk of unprotected sex. That's a big topic that we want to hit on for the simple fact. So if we look at some stats from 2018 from Indiana, if you look at, there were 34,000 cases of chlamydia, 12,000 cases of gonorrhea, and 365 cases of syphilis, which is really important to talk about because currently right now there is a syphilis outbreak in this current zip code on the west side. So it's very important to talk about, and it's going around the city. So why do we talk about STDs? Well, somebody who is prone to getting constant STDs or using having unprotected sex is very high risk for HIV. So if we go to our next slide, we look at the HIV risk indicators. So we'll talk about some behaviors that we see on here. So somebody that is high risk, somebody that is having oral, anal, and vaginal sex. Also people that are having sex under the influence of drugs or alcohol often. Not knowing your own HIV status, but also not knowing your partner's HIV status. And then sex workers, exchange drug needles, and IV users fall into the high-risk categories. So some people may have mixed behaviors, so they may fall in the middle or as low. And this also depends as to when you're talking to your provider as to how often we want to test you for HIV. Somebody who is typically in the low category will get tested at least once a year. So even if you aren't having sex or if you're in a monogamous relationship, we recommend for you to get tested at least one time a year. If you're in the middle, we'll go about every 6 months just to monitor to make sure that you're okay. And if you're high risk, you may do every 3 months unless your provider indicates otherwise. So now we look at some numbers. I agree with Robert. Numbers make me a little confused, but graphs help a little bit. So if we look at up here, Black and African American male-to-male sexual contact is the highest impacted community, being followed by the Hispanic, Latino, male-to-male sexual contact. But then you also see stats for white males, white African American women, and heterosexual men, and then Hispanic women, Latinas, and then white women at the bottom. So some of those numbers are pretty high, and the differences that we see from the bottom to the top are very high. So that's by gender. And then we look at a comparison between Black men and Latinx individuals. Just at the so middle male contact, you're looking about a little bit higher than 80%. But then there is a small percentage that is infected by HIV by injection drug use, which is at 3%. So just a little bit things to consider. And then if we move forward to Black women and Latina, this one's really alarming, just because, like Robert mentioned, for a long time people thought that HIV was something that only belonged to gay men or in the queer community. Most Black women and Latinx women get HIV from heterosexual contact. So it's a very important conversation to have. Julie mentioned to end the stigma around HIV, and that's what happens. When you start talking about it more, when you educate yourself more about it, you help these numbers get lower down. Cool, so why are the numbers so high? So one of them, higher rates of sexually transmitted diseases, stigma, discrimination, and mistrust of the healthcare system. So thank you, Julian, for hosting this event. Socioeconomic disadvantages with these minority groups, migration patterns, lower level of education, and language barriers. And then 1 in 6 Latinx, Hispanic are unaware of their status, and then 1 in 7 Black African Americans are unaware of their status. So these numbers may not seem like too big, but in the bigger picture and the grand scheme of things, they're pretty alarming, and we want to make sure that we continue to talk about it and decrease them. So why are we talking about all of this? So at Shalom, we have a new campaign that we launched called Mi Gente. Mi Gente is specifically targeted towards the Latinx community, and we talk about how to prevent HIV, treat it, and also just how to educate individuals about it. So this is our website for Mi Gente, so it's migenteprep.org. On here you can book an appointment with our PrEP navigator, or you can come in to see a provider or ask any questions, and it's completely free. And we definitely walk you through the whole process from start to end, from getting a free HIV test to consulting about PrEP, having that conversation, and then following through with the process with the provider. And then in the future, coming up, we have Photo Culture, which is going to be a similar campaign like Mi Gente, but directly specifically towards the Black community. So we're super excited to be launching this here in the upcoming months, because obviously with those numbers, it's something that's needed, that we need to bring. So along with Damien Center, we're just doing those efforts specifically to help these communities, to help these numbers go down. So it starts with you, right? So the change. So we made a little PrEP thing here. So it starts with prevention, with risk reductions, education, and progressive attitudes. So what does that mean? So we go into, let's talk about PrEP and PEP. So Robert kind of mentioned that earlier. So PrEP is one of our biggest ways of preventing HIV currently. It's a medication that you take once a day. It's a small pill. And what that pill does, it helps you prevent HIV. I want to say it decreases the chances to 1% transmission with PrEP.
There is a lower chance. There is a higher chance not to get it from 92 to 99.
Yes. Yeah. So
to 1%.
yeah, and PrEP stands for pre-exposure prophylaxis. So yeah, you take that pill once a day, typically around the same time. You do have to have constant communication with your provider every 3 months just to make sure, because it is a medication, so we want to make sure that your body is reacting normally to it and that your kidneys are okay. And obviously we want to make sure that it's working. Then we have something that's called PEP. So PEP, if you feel like you have been exposed to HIV for any reason, whether you're having intercourse and the condom breaks, or if you're a victim of sexual assault, you can go to an ER, or you can come to Shalom and you can ask for PEP. So it is a treatment that we give you for a month. You basically start taking PrEP and 2 other pills, just to make sure that your body fights off. And you do have to get on it within 72 hours of exposure, of possible exposure. So it is kind of like a race against time, but it's important that we put this information out there because not a lot of people know that it's available. And I know that if you come to Shalom, Like we mentioned earlier, if you don't have insurance, if you don't have the means to get it, we will work with you and we will find somewhere that can help you provide that for you.
We also have the prep 7 days samples right there too, so they can start right away.
Yeah. So everyone said that we also have 7-day samples of prep that you guys can start, that we can start right away. We do have a project that we're looking to launch this summer. We'll call it our prep clinic. We'll be on the community, so we may go to different universities with a provider. We can do blood draws, STI panels, and get you registered for prep right away versus the whole process that may take a little bit longer. So cool. How do we fight these things? So best practices for sex. We want to look at so being aware of STDs, so getting tested regularly every 6 months, every 3 months. Using water-based lubes with condoms. Best hygiene with toys, whether you're sharing or you're not sharing. Being honest with your partners is a huge one. I always tell people if you don't feel comfortable asking your partner about their STD status or their HIV status, you should not be having sex with them. So it's a very important thing to have in mind. And yeah, ask about status. Go get tested together. I don't know. It's free. You can get it free at so many different places here in the city. So keep that in mind. We have places like Daily Center, like Shalom, Step Up, BU Wellness, and Eskenazi at the Bellflower that will definitely help you out. Doesn't matter where you go. It's not a competition as long as you go and get the information and get tested. So how do we, what's the relationship look with Marion and us? So we do offer internships for you guys, and rotations and also shadowing is available for students. So if you guys ever do want to come and shadow us and kind of see what we do at our center, feel free to reach out to us. And because we're super close, you can see here on the map. So we're still 6 minutes away. So even with your students, so we're really looking forward to partnering with you guys in the future, even if we can bring our mobile clinic here and do an event and we can test a lot of your students. But yeah.
HIV and AIDS should not be something that we are worried to talk about, uncomfortable to talk about. It's something that is present, it exists, it's real, and especially with the numbers in Indiana is something that's very important to know about and act on. So yeah, I'm very, very happy that we can provide you with this information and start the conversation here in Marion, and I'm hoping that there will be many more opportunities to come in the future where we can continue this conversation and learn and grow together. So if you joined on our Instagram Live, thank you so much for joining and giving your time. If you're watching this pre-recorded, then that means that I got it onto the website. So there you go. So thank you so much and have a good